What is multiple sclerosis?
Multiple sclerosis is an inflammatory condition that affects the nerves within the brain and the spinal cord.
What are the signs and symptoms of MS?
Signs and symptoms of MS can vary hugely depending where within the nervous system is affected. The example would be if you had some inflammation in the nerve behind the eye, that might affect your vision on one side, or if you had some inflammation within your spinal cord, you may develop sensory symptoms down one side of the body.
What is an MS relapse?
We typically define an MS relapse as a new neurological symptom that lasts longer than 24 hours, and there's no evidence of any coexistent infection or other illness that might be contributing to it.
What is a pseudo relapse?
So a pseudo relapse in MS is usually recurrence of old symptoms, and this often happens in the setting of a coexistent illness. So if you had a urinary tract infection and had a high temperature, you might transiently have some of your old symptoms back.
How is MS diagnosed?
Making the diagnosis of MS encompasses a couple of things. So the first is the clinical history. So what symptoms did you experience? Combine that with the radiological picture, so that's what changes we see on your MRI scan. Then we often do a thing called a lumbar puncture, looking for a protein called oligoclonal bands, and that can also be supportive rather than truly diagnostic of MS. And when we take those three pieces of information together, there's a certain likelihood that this is MS, and the next step then is ruling out other things that might mimic it. So it's a kind of a multi-step process, and we usually rely on a certain criteria called the McDonald criteria to make the final diagnosis.
What causes MS?
So this is the hardest question in MS because really the cause is unknown, despite many attempts to try and tease it out. I think it's important to stress that it's not caused by any one thing that someone has done, and there's no way that you could have prevented this happening to you. I think there are a number of things that we know are associated with MS and potentially increase the risk, but these are often things that are very common in the population, so alone are not the reason it happens. An example would be that often in people with MS, we see a low vitamin D. This is a very common finding in Ireland anyway.
Is MS a progressive illness?
There's many different types of MS, and obviously it can change over time. There's no one type that's better or worse than the other. Typically, in the beginning, the majority of people present with what's called relapsing remitting MS. And at that point, they usually develop new symptoms, these ease away, and then they may go in a period of time without having any further symptoms and then have another attack. And over time, we do see a certain percentage of these people may develop some disability or be termed secondary progressive. There's a very small amount of people who present with a kind of a progressive onset from the beginning. We don't really know why this happens, and we think that it is all part of the same spectrum.
Does everyone with MS experience progression?
The answer to this is no. There is a small cohort of people with MS who run a very steady, static course and don't really show any signs of progression over a number of years. But we do see over time, a lot of people with relapsing remitting MS will develop some progressive symptoms. I suppose the difficulty here is that the treatment landscape has changed so much in the last number of years, and that we're seeing that this is happening to smaller numbers later and later. So it's kind of an unanswered question and quite a changing space in MS at the moment.
Is there any specific diet people living with MS should follow?
So I think like all aspects of life, unfortunately, we're bombarded with different advice around diet that's going to ultimately alter our life. And the same has been said in MS. I think there's no hard evidence to suggest that you should follow any particular type of diet. I would recommend a well-balanced, nutritious diet and moderate alcohol intake, and you will be fine.
Is MS a terminal illness?
So I think MS is a very treatable illness, and we now have a huge treatment landscape to offer people. And ultimately, people now live with their MS into their later years and often die of conditions completely unrelated to it.
Can MS be cured?
So we've no definite cure for MS, but as treatments have gotten better, we've seen people go through these extended periods of seeing no disease activity, which is our ultimate goal of treatment.
Can MS go away by itself?
So there's really no evidence to support that MS will go away on its own. By the nature of the disease, there's a huge spectrum from milder end to more aggressive end, but there's nothing to suggest it regresses without doing anything. And I think if treatment is recommended by your neurologist, it's certainly worth strongly considering.
What is the best treatment for MS?
I think this is a very individual question, and it's something that you really need to talk with your neurologist or your MS nurse about, because I think when deciding what treatment to go on, it's dictated by a lot of personal factors. So how you are clinically, how active your MS is, what your future plans are, particularly around things like children, if you're a woman. So I think this is something that I would say is very individual and something that requires a sit-down meeting between you and your neurologist or you and your MS nurse to go through those different aspects.
Can I drink alcohol if I am on treatment for MS?
Yes, but I think our advice around alcohol is always going to be in moderation. And I think you need to be particularly careful if you're someone who's has some balance difficulties and prone to falls, because we know that unfortunately alcohol can make all those things a little bit worse.
Can people living with MS smoke?
So I suppose like all things in life, people with MS can of course smoke, but smoking has been shown to have quite a negative impact on MS. So it's associated as a risk factor for MS, but also people who smoke have been shown to have more progressive disease than those who don't. So I suppose if you were going to kick it on the head, it would be one bad habit to maybe look at giving up.
Can people living with MS have intimate relationships?
So there's no reason why a person with MS couldn't have an intimate relationship, but sexual dysfunction is probably underreported, and there are many factors that can feed into this. Sometimes it can be low self-esteem, loss of libido, and I think that it's probably something that should be reported to your neurologist, because there are lots of potential treatment pathways that can be trialed or gone down.
Can people living with MS take contraceptive medications?
There's no reason why people with MS can't be on contraception, whether they decide to take the daily pill or whether they decide to use one of the implantable devices such as a Mirena coil or Implanon. There's also no contraindication to using emergency contraception if that's felt to be needed.
Can people living with MS have children?
So I think that's a very important question, and very important to stress that yes, of course, people with MS can have children. This is a disease that commonly affects women of childbearing years.
Is it safe for people living with MS to have babies?
So all evidence would suggest that there's no real contraindication to having children for people with MS. We do see some changes throughout the pregnancy in terms of risk of relapse. So early in the pregnancy, as we move into the second and third trimester, the risk of relapse appears to drop. And in the post-delivery period, this can increase a little bit. And all this means is that there needs to be some careful planning and linking in with your neurologist around discontinuing medication and restarting medication following the delivery.
Will the baby have MS?
Again, I think this is a very good question, and something that I'm sure lots of people worry about. We don't know the exact cause of MS. There is potentially a small genetic component, because we know that people who have relatives with MS are at a slightly higher risk of getting MS, but this is very low. It's in the region of about 2%, so that's about 2 in 100. So there's much more children born to people with MS who don't get MS than do. I think you need to bear that in mind.
Can women living with MS breastfeed?
There's again no reason why women with MS can't breastfeed. Factors that do sometimes influence decisions around this is what treatment you're on, whether your MS was felt to be very active and there was a concern and it was preferred that you would go back on treatment quite early after the pregnancy. So again, I would say I think this is a very individual question, and it's something that's worth having a conversation with your neurologist or MS nurse about.
Can people living with MS work?
So I think there's no reason why people with MS can't work. There may come a time when people want to explore other options or look at reducing hours, and that's something that's very individual and personal and may evolve over time.
Can people living with MS travel?
The straight answer is people, of course, can travel, but it will depend on what type of medication you are and what you need to take it with you. Some medications need to be refrigerated, or you need to bring certain things like a sharp spin with you. But but there's no reason why you can't travel with MS, no.
What is the prevalence of MS in Ireland and globally?
So it's estimated that there's about 10,000 people living in Ireland with multiple sclerosis, and we have about 300 new cases diagnosed here every year. Recently, the Multiple Sclerosis International Federation updated their World Atlas of MS and determined that there was 2.8 million people with MS living in the world. I think this is interesting because we are seeing increasing rates and newer countries reporting rates of MS, and this is still likely an underestimation of the total numbers worldwide.